Hi friends, Tony DeWitt here, Missouri appellate attorney and a guy who likes to make the law make sense on YouTube. Here's what we're discussing today. Today we have the kind of case that really made me want to become a lawyer. It's what I call a double O doc case. You know, double O like 007, a doctor licensed to kill. As regular viewers of this channel will know, I spent 13 years as a respiratory therapist before becoming a lawyer. During that time, I worked with some excellent physicians and surgeons, and some who should have had chaperones. I saw some medical malpractice at different times, but each time I saw it, nobody died. And every time I saw it, someone had tried to cover it up. For the most part, my work was with intensive care physicians who knew what they were doing. It was generally the older community docs who had been practicing since the 1950s who quite simply didn't keep up and were the ones who were more likely than not to make an error. I had two favorite surgeons I worked with in a bronchoscopy lab, and as you know, a bronchoscopy is where a doctor puts a light down your throat into your lungs and either looks for a tumor or removes a foreign object or takes a biopsy or does a brushing to remove cells so they can be analyzed by a pathologist. It usually is a procedure that takes somewhere between 10 to 15 minutes. And one of my favorite docs was a doc by the name of Dr. Jomain. He was from Senegal, and he talked with a French accent. And he was a great doctor. But because everybody makes mistakes, I had to apologize for something. And at this point, I still don't remember exactly what it was that I had to apologize for. But I said, I'm sorry. And he said, don't be sorry. Don't apologize. Just do better next time. It stuck with me. And I think it illustrates to a certain extent both what is right and what is wrong with medicine. You can't expect doctors to be perfect. And so you can expect them to make mistakes. And when they do make mistakes, what you can expect them to do is tell you and fix it. When I became an attorney, I wanted to work in the area of medical negligence for a couple of reasons. One, I felt like I had suffered from medical negligence early on in my military career. And I also felt like by virtue of having worked as a therapist and having a lot of intensive care experience, that I might know a thing or two that would be really helpful in prosecuting a medical negligence case. And over the course of the years that I worked in that area doing medical negligence cases, I saw some real doozies. One incompetent chest surgeon shoved bone wax into the spinal canal. Now, bone wax is what surgeons use to stop bones from bleeding. It's just basically beeswax that has been purified and has been sterilized. And when they see that a piece of bone is bleeding, they just shove this bone wax into it. Well, he shoved bone wax in to an area that was continuing to bleed, and he kept putting bone wax in there until it went into the spinal canal. Well, when it does that, it shuts off the blood supply to the rest of the spinal cord. Initially, that causes a loss of sensation, and if you get it fixed or removed pretty quickly, there's not any long-term damage. But in this case, they didn't do that, and as a result, this poor lady was paralyzed from the waist down. Now, he would never admit what he had done, and he and his partner changed the hospital records to pad their defense. We found the actual records in his own records from his office. The mistake that he made was one that any surgeon could have made. He did it because he was not careful, but he wasn't criminally negligent. He wasn't disregarding known risks. He was just not as careful as he reasonably should have been under the circumstances. Now, I'm going to talk today about a case that is more than just simple negligence. It likely is criminal negligence, and it happened in my backyard at St. Mary's Ascension Health Center in Destin, Florida. Here's how the local news media reported the story.
He says that a Florida surgeon misidentified William Bryan's liver as his spleen and removed it instead, ultimately causing his death.
70-year-old William Bryan and his wife Beverly were visiting their rental property in Destin on August 19th when he felt pain on his left side.
When he started having some pain in his left shoulder, his neck, and his left side. So we went to Sacred Heart on the Emerald Coast, and he was admitted and became a patient of Dr. Shaknovsky's.
Beverly, a retired nurse, said Dr. Thomas Shaknovsky diagnosed a spleen surgery and urged it to be performed by him.
We called Bill's doctor, Dr. Danny McFall, here at home in Northwest Alabama, and he told Bill that he would have surgeons here in North Alabama waiting when we got home. I tried to convince Dr. Shaknovsky to let me take him home or arrange for him to be transported, but Dr. Shaknovsky said that Bill would bleed to death if he was moved.
So you may wonder how a surgeon could mistake the liver for the spleen. Well, let's look at an animation of the spleen and liver here. The spleen is a little thing that is rotating around over there on the left side of the body, right side of your screen. And the liver is on the right side of the body. It's that big organ up at the top. The spleen is on the left side of the body in the abdomen, and the liver is on the right side of the body directly under the lungs. If the spleen is on the left and the liver is on the right, how did this doctor make that kind of error? Well, first, before we get into that, let's talk a little bit about the way things used to be. Up until about 1988, when a surgeon wanted to remove a spleen or otherwise operate on the abdomen, he did what was called an open procedure. And the reason it was called an open procedure is because they opened up the abdomen and went in. In an open procedure, the surgeon makes an incision in the area where the damaged organ is, cuts through the abdominal wall, visualizes the anatomy, finds and fixes the organ or removes it if he has to, and he finds the organ using anatomical landmarks. Think of them like sort of street signs telling the doctor where he is and that he's in the right place. Then, when he's finished with the surgery, he sutures back up everything that's been cut. He makes sure there's no bleeding, and then he sutures the abdominal wall back together, closes the big wound on the belly, and sends the patient to recovery. Well, there are benefits to open procedures, including being able to be certain of the anatomy that you're looking at and knowing that you're either on the right side or the left side of the patient. But there are also some rather severe drawbacks. It takes longer to heal from an open procedure, and because people's bellies are cut, it can be very painful to try and cough, because every time you cough with an abdominal incision, you're pulling at that material, at the cells that are trying to knit back together and form a cohesive seal in your abdomen. So it can be very painful. And as a result of people not being able to deep breathe and cough, they sometimes wind up with pneumonia. In addition, you have a much greater risk of an infection in an open procedure, and you generally have a much longer recovery time. In the late 1980s, a surgical tool first used mostly by orthopedic surgeons, the laparoscope, came into its own. With a laparoscope, a small slice is made in the belly button and the scope is inserted, and other incisions are made along the way, and gas is blown in or insufflated into the abdomen. And that provides room for the laparoscope to move around and find those anatomical landmarks to be sure you're operating on what you're supposed to be operating on. Because unlike the situation with an open procedure where you've got big lights over the operating room table and you can see directly into the abdomen, here you're looking through the camera at the end of the scope that is being inserted into the abdomen. The laparoscope is a lot more difficult to work with. It requires more skill, and you sometimes see anatomic mistakes as well as failures to properly suture or stop bleeding in these surgeries. The camera at the end of the laparoscope is very, very small and doesn't have great depth of field. And even though the physician isn't looking through the scope to operate, in other words, he's not got his head to the scope looking at it like this, he's looking at it up on a monitor, it can still be very hard to know where you are and find those anatomic landmarks. The lawyer representing the wife of the decedent was appalled by what he found. It seems that this case was not the surgeon's first rodeo.
We then did some research into this particular doctor, and it turns out this is not the first time he's had a wrong site surgery in the last 2 or 3 years. He, in the last couple of years or so, he actually accidentally took out a portion of somebody's pancreas, intending to take out one of their adrenal glands. So we're dealing with somebody that has a history of wrong site surgery.
So there you have it. In a prior case, he took out part of the pancreas while trying to remove an adrenal gland. Yikes! A surgeon I spoke with on another case told me that surgeons have 2 primary rules. Sleep when you can, and don't touch the pancreas. In that case, it appears that the patient didn't die, but still, that's pretty amazing. In this case, what we have here is a doctor who really just didn't know what he was doing. The liver looks nothing like the spleen. It's in a completely different part of the body. The spleen is 1/5 the size of the liver, and it's shaped differently. And the tissue of the liver is much more richly perfused. He was clearly in over his head from the jump, and he failed to convert to an open procedure when he should have, and as a result, the 70-year-old man died. That may establish that the surgeon was not just negligent, he may have been criminally negligent. The Walton County Sheriff is indeed investigating. Florida has a number of statutes that protect people over 60 years of age, which they refer to as elderly, which irritates me because I'm 69 and I don't feel elderly. But they have these laws that protect them from abuse and neglect. And I think cutting out a vital part of your body, one that you absolutely have to live, and not understanding why the patient is losing blood by the bucketful and not being able to stop the bleeding, I can see where that might make it a case where felony manslaughter is appropriate. And in terms of negligence, it might not be just the doctor who gets sued. The hospital might be liable for negligent credentialing, or allowing this man to continue practicing when they knew he had a problem in the prior case about properly identifying surgical structures. This is clearly a doctor who shouldn't have been doing laparoscopic surgery. The question is, A, should he have privileges at a hospital? And B, should he still have a license? But here's the real bite in this case. In most states, wrongful death is wrongful death, irrespective of whether you're run over by a train, hit by an accidental firearm discharge, or malpracticed upon. Not in Florida. In Florida, only the spouse or minor children can sue for wrongful death as a result of medical negligence. If an adult son has a widowed mother who dies from medical negligence, he cannot sue for her death. I think that's wrong, and I think it violates equal protection, but that's just my opinion. So that's what I have for you today. I hope that you found this as interesting as I did. I look forward to following this as it moves through the process of determining what has happened. And I will probably contact the lawyer in this case and see what he can tell me as well. If you have any questions, drop them in the comments down below, or you can email me at the address above. Like, share, subscribe, all those things. We would really appreciate that. And if you have the opportunity today, do a kindness for someone. Doesn't have to be a big, you don't have to buy them a car, but maybe you could buy them a coffee. At any rate, do something nice for somebody. It'll make you feel good. It'll make them feel good. And who knows, you might wind up with a new friend for it. After you've done that, after you've made somebody's day, come on back tomorrow. Join me at the beach, and we'll talk about something else fun. If you like this video, here are a few others you might try, and don't forget to subscribe. Have a terrific day, guys.